Laminitis is a significant and painful condition that affects the hooves of horses, ponies, and donkeys. This disorder occurs when the sensitive laminae, which connect the hoof wall to the underlying coffin bone, become inflamed. The inflammation can lead to severe pain and structural changes in the hoof, often resulting in permanent damage. Understanding the causes, recognizing the signs, and knowing how to respond are crucial for horse owners to effectively manage and prevent this debilitating condition. There are several common causes of laminitis, and awareness of these factors can help prevent the disease from developing. One of the primary risk factors is metabolic disorders, such as insulin resistance or Cushing's disease. Horses that are overweight or obese are at a higher risk for developing these conditions, which predispose them to laminitis. Additionally, certain diets rich in carbohydrates, especially those involving excessive grain or lush pasture grazing, can contribute to the onset of laminitis. Sudden dietary changes can be particularly dangerous, as a rapid increase in sugar intake can trigger a laminitic episode. In addition to dietary concerns, physical stress can also lead to laminitis. Horses that experience significant trauma to their hooves, such as those involved in heavy work or competition, are more susceptible. Other causes may include post-surgical complications or systemic infections that can impact the hooves. Stress and trauma can disrupt blood flow to the laminae, resulting in inflammation and pain. Recognizing laminitis early is vital for effective treatment and recovery. There are several key signs to watch for. One of the most noticeable initial symptoms is a change in the horse's stance. A horse suffering from laminitis may shift its weight from one hoof to another, seeking relief from discomfort. You may observe the horse standing with its front legs extended forward, a posture known as founder stance. Laminitis is a serious and often painful condition that affects the hooves of horses, ponies, and donkeys. It occurs when the sensitive laminae, which attach the hoof wall to the underlying coffin bone, become inflamed. This inflammation can lead to severe pain and can even cause the coffin bone to rotate or sink, resulting in permanent damage to the hoof. Recognizing the signs and understanding the risk factors are crucial for horse owners to take proactive measures to prevent laminitis or mitigate its effects. One of the first things horse owners should know is that laminitis can be caused by a variety of factors, including metabolic disorders, overfeeding, and excessive stress on the hooves. Common triggers include obesity, grazing on lush pastures, and sudden dietary changes. Horses that have conditions like Cushing's disease or insulin resistance are at a higher risk of developing laminitis. In addition, certain medications, such as corticosteroids, can exacerbate the condition if not managed carefully. Recognizing the early signs of laminitis is essential for timely intervention. One of the most common initial indicators is a noticeable change in the horse's stance. A horse affected by laminitis may shift its weight from one hoof to another in an attempt to alleviate discomfort. You may observe the horse standing with its front legs out in front of its body, a posture known as founder stance. This position helps alleviate pressure on the painful hooves. Any reluctance to move or a change in gait can also signal that something is wrong. Another sign to look for is an increased sensitivity in the hooves. When you pick up a hoof for a routine check, the horse may flinch or show discomfort when you touch the sensitive areas. The temperature of the hooves can also be a key indicator. If the hooves feel warm to the touch, especially in comparison to the rest of the body, this could indicate inflammation. An increased pulse in the digital arteries, located just above the fetlock, is another concerning sign. A veterinarian can check this during an examination, but owners may notice thumping or strong pulses if they regularly monitor their horses. As the condition progresses, the signs may become more severe. A horse suffering from laminitis may become increasingly reluctant to walk, often leading to a very stiff, stilted gait. You may also notice changes in your horse's demeanor, such as irritability, restlessness, or even signs of colic. These changes can be alarming for any horse owner, and they necessitate immediate veterinary attention. If laminitis is suspected, quick action is essential. Consulting a veterinarian should be the first course of action. The vet will perform a complete examination, which will likely include checking the horse's hooves, assessing its overall health, and evaluating any underlying conditions. Diagnostic imaging, such as X-rays, may also be required to assess the position of the coffin bone and determine the severity of the laminitis. Early diagnosis is crucial, as the sooner treatment begins, the better the chances are for recovery. Treatment for laminitis typically involves a combination of veterinary care and owner management. The first step in treatment is to remove the underlying cause of the laminitis. This may involve changes to the diet, including reducing or eliminating access to rich pastures and providing appropriate feed to manage weight and insulin levels. In some cases, medications such as anti-inflammatories and pain relievers may be prescribed to manage pain and reduce inflammation. Your veterinarian may also recommend dietary supplements or special hoof care products to support hoof health. Keeping the horse comfortable is also a priority in managing laminitis. Providing a soft, cushioned surface for the horse to stand on can help alleviate pressure on the hooves. If possible, keep the horse on a dry, clean surface, such as sand or shavings, and avoid concrete or hard ground surfaces. In advanced cases, a veterinarian may recommend therapeutic shoes or hoof pads to provide additional support and protection. Ongoing monitoring is vital during the recovery process. Regularly checking the horse's temperature, pulse, and overall condition is essential to ensure that there are no complications. Engagement with your veterinarian throughout this period is necessary to adjust treatment plans as needed. In addition to physical assessments, monitoring the horse's behavior can provide insights into how well they are coping with their condition. Prevention is always the best approach when it comes to laminitis. By being aware of the risk factors and implementing regular health checks, horse owners can significantly reduce the likelihood of laminitis. Maintaining a healthy weight is essential, as obesity is a major risk factor for the condition. Regular exercise, suitable nutrition, and avoiding sudden dietary changes can help prevent laminitis from developing. It is essential to provide a balanced diet that is appropriate for the horse's age, activity level, and any underlying health issues. Consult your veterinarian or an equine nutritionist for tailored dietary recommendations. Monitoring pasture quality is also essential for preventing laminitis. During spring and early summer, pastures can be particularly rich in sugars, which can contribute to laminitis, especially in susceptible horses. Limiting access to these pastures during peak growth times can help reduce the risk. In addition, it's important to use caution when introducing new feeds or supplements, as these changes can also trigger laminitis. Regular hoof care should not be overlooked. Working with a knowledgeable farrier who understands laminitis and its impact on hoof health can lead to better management strategies. Regular trims and proper hoof balancing can ensure that the horse's weight is distributed evenly across the hooves, which helps to prevent conditions that could lead to laminitis. Another preventative measure is regular veterinary checkups to monitor for any underlying health issues that could predispose a horse to laminitis. Regular blood tests may be necessary to monitor insulin levels in at-risk horses and address any concerns before they escalate. Early detection of metabolic issues can play a significant role in preventing laminitis. Understanding laminitis is essential for any horse owner. Recognizing the early signs and understanding the risk factors can help you respond promptly. A proactive approach to managing your horse's health through proper nutrition, weight management, hoof care, and regular veterinary visits can make a significant difference. With vigilance and care, many horses recover from laminitis and lead healthy, active lives. Staying informed and attentive can help ensure your horse's well-being and longevity.